Welcome back to TCTV On Location. I'm Melina Caruso here at the Toledo Clinic, and I'm here with Dr. Jason Levine. He's a sports medicine physician and orthopedic surgeon. Okay, the knee. It can cause a lot of people pain and grief, and one injury could be a meniscus tear. Can you explain what that is?
Sure. The meniscus is a structure in the knee that allows for cushioning of the bones. Sometimes if you have a twisting injury, that meniscus can get caught between the bones and tear. So a lot of people will experience pain. They'll have clicking, catching, locking, popping. And if those are symptoms that stick around for about 6 weeks or so, usually that's time to come in and get checked out.
Okay, so if I come in, I have this knee pain, what is the kind of the diagnosis process you would go through? Because it's a big joint, it's an important one.
It's one of the most common injuries we see in orthopedic surgery. And so you'd come in to see me. I would get an x-ray to make sure that there's not a lot of arthritis. I would do a physical exam, which would include testing out the knee and checking that meniscus. If it does show evidence of a meniscus tear, then a lot of times I'd order first physical therapy and some medications, maybe even an injection. And if you continue to have problems after a 6-week course, then that's where an MRI might be needed to confirm the diagnosis, and we might have to talk about surgery.
And with injuries like this, this is an injury to soft tissue, connective tissue. Kind of explain the difference in the healing process between this or a break or a fracture.
Sure. So the meniscus really doesn't have a lot of blood supply. So unfortunately, if you tear your meniscus, there's a chance that it might not heal, and that's why patients continue to have problems. So initially, we try to give it that 6-week period to heal up, but knowing that the meniscus really doesn't have a very good blood supply, if you continue to have it, then that's where a surgery might be necessary because it's not going to heal on its own.
Okay, so some preventative measures. Is there anything people can do to prevent a tear other than, if there is an accident, accidents happen?
Sure, just keeping good physical fitness and strength of your muscles, doing activities that you're familiar with, and if you're a little bit older and you haven't played basketball in a while, maybe being careful about getting out there and doing that. But just going ahead and keeping good physical fitness is a good way to balance the leg.
All right, well, thank you so much, doctor. This is all the time we have for right now. We'll be back with more later.